Hi everybody, welcome to Health Wanted, the place to be for healthy living. Today, we are going to talk about sleep apnea, including its causes and treatment strategies. Make sure to watch until the end because there is very interesting information for people who suffer from this condition. Subscribe to our channel so that we can provide you with essential information to help you maintain good health and well-being. Let's now go to the video. What is sleep apnea? Sleep apnea is a condition in which you stop breathing while sleeping. This occurs due to a blockage of your airway, obstructive sleep apnea, or because your brain does not manage your breathing appropriately, central apnea. The lack of oxygen that results stimulates a survival instinct that wakes you up just enough to resume breathing. That reaction, although keeping you alive, also disrupts your sleep cycle. This impairs healthy sleep and can have severe implications, such as placing stress on your heart, which can be fatal. What is the impact of sleep apnea on my body? Understanding how sleep apnea works requires some knowledge of the human sleep cycle. Sleep occurs in several stages. Stage 1 consists of light sleep. This is a brief stage that begins just after you fall asleep. It accounts for around 5% of overall sleep time. Stage 2, more deep slumber. This stage is deeper and accounts for approximately 45% to 50% of total sleep time. This figure increases with age. Slow wave sleep is the third stage. This is the deepest sleep stage, accounting for around 25% of total sleep time. This figure decreases with age. It's difficult to wake someone up during stage 3 sleep, and waking up directly from it frequently results in sleep inertia, mental fog, and slower thinking. In this stage, parasomnias such as sleepwalking and sleep-talking occur. REM sleep. REM is an abbreviation for rapid eye movement. This is the stage where you dream. You may see a person's eyes moving beneath their eyelids when they are in REM slumber. When you fall asleep, you usually enter stage 1 and then cycle through stages 2 and 3. After cycling through those stages, you'll enter REM sleep and begin dreaming. Following the initial REM cycle, you begin a new cycle and return to stage 1 or 2. Normally, one cycle lasts 90 to 110 minutes before the next begins. Most people have 4 or 5 cycles per night, assuming they receive 8 hours of sleep. How sleep apnea interferes with your sleep cycle. Your brain constantly analyzes the state of your body and changes your heart rate, blood pressure, respiration, and so on. When you stop breathing due to apnea or hypnea, your blood oxygen levels can drop. Apnea is derived from the Greek roots a, which means not, and ni, which means breathing. Its combined meaning is breathless. Hypnea is a combination of the Greek words hypo and ni. The word hypo comes from the Greek word for low or under. When you combine these root phrases, you get underbreathing or low breathing, which suggests you're not breathing enough to keep your blood oxygen levels stable. When your blood oxygen levels fall because to apnea or hypnea, your brain activates a fail-safe-like reflex, waking you up long enough to breathe again. Your brain seeks to restart your sleep cycle when you resume breathing. The severity of your sleep apnea determines how frequently these interruptions occur. The apnea/hypnea index, AHI, is the average number of apnea or hypnea occurrences, pauses in breathing, per hour. The AHI is the key determinant of sleep apnea severity. The seriousness level is as follows. Mild sleep apnea is defined by an AHI between 5 and 15. That means they have 5 to 15 episodes of apnea or hypnea every hour. However, symptoms are also considered by healthcare professionals at this level. If you don't have any other symptoms, they may not consider it serious enough to treat. Individuals suffering from mild sleep apnea have 15 to 29 episodes each hour. That means an 8-hour sleeper stops breathing and or awakens 120 to 239 times. Severe sleep apnea. People with this problem wake up 30 or more times per hour. That is, they stop breathing and or wake up at least 240 times during an 8-hour sleep cycle. Obstructive events, which are usually brief, can disrupt any stage of sleep. They are more common in stage 1 and stage 2 sleep, as well as in REM sleep. As a result, it is possible for people to forget apnea incidents, which means they may not realize they have a problem until symptoms appear. Central events are most common in the first and second stages of sleep, but they can occur at any point. What are the signs and symptoms of sleep apnea? When you wake up, you may feel fatigued or even exhausted. Even after a full night's sleep, people with sleep apnea are frequently exhausted. Sleepiness during the day. In more extreme cases, this might lead to drowsiness while driving, working, or engaging in other activities. Snoring. This is a common symptom of sleep apnea, but it does not occur in all cases. Sleep apnea can also occur without any snoring. The mood shifts. Depression and anxiety are common sleep apnea symptoms. Brain function disruptions. Memory loss, difficulty concentrating, and other brain-related difficulties are examples. Frequently waking up in the middle of the night. This symptom may be more difficult to detect because most people do not remember waking up or why they woke up. People who do this frequently recall waking up for another cause, such as heartburn or the desire to use the restroom. Others notice pauses in breathing while sleeping. While you're sleeping, your spouse, lover, or another loved one may notice these signs. Breathing patterns that are unusual. Cheyne-Stokes breathing, CSB, is a unique breathing pattern that can occur as a result of central sleep apnea. CSB produces rapid breathing that becomes deeper and then shallower until breathing ceases completely. After a few seconds of not breathing, they will begin breathing again, repeating the pattern. Insomnia. Night sweats and a rough night's sleep. Dysfunction in sexual relationships. You wake up feeling out of breath or as if you're suffocating. Headaches, particularly when waking up. What causes sleep apnea? Sleep apnea usually has specific causes, and there's evidence that it may run in families. Overall, there are 3 main forms of sleep apnea, with some differences in how and why they happen. The types are obstructive sleep apnea, OSA. This is the most common variant. When the muscles in your head and neck relax while you sleep, the surrounding tissue presses on your windpipe, resulting in obstructive sleep apnea. This prevents air from passing through it. Snoring can be caused by it. Central sleep apnea, CSA. This type of sleep apnea is caused by an issue in your brain. In normal circumstances, your brain controls your breathing at all times, including while you sleep. Central sleep apnea occurs and your brain fails to deliver signals to your breathing-related muscles. Central sleep apnea can occur for a variety of reasons, including heart failure. High altitude causes low blood oxygen levels, hypoxia. Nervous system damage, particularly in the brainstem, which controls your breathing, or sections of your spinal cord. Mixed sleep apnea. As the name suggests, some people experience both obstructive sleep apnea and central sleep apnea at the same time. How is sleep apnea treated? There are numerous techniques to treating sleep apnea, depending on the type and severity of the apnea. While none of these are cures, they can help prevent apnea occurrences or minimize how frequently or severely they occur. Many therapies should be incorporated into your daily or overnight regimen. This can eventually minimize or even remove the consequences of sleep apnea on your life for as long as you use these therapies. Treatment options include treatments that are conservative in nature. These non-medical remedies or practices can usually improve or cure obstructive sleep apnea. They are not cures, but they can lessen apnea to the point where it no longer occurs or is not severe enough to cause symptoms. These are some examples. Weight reduction. A 10% weight loss can considerably improve sleep apnea in those who are overweight or obese. Position adjustments during sleeping and sleep help devices. Sleep apnea is more prevalent if you sleep on your back. Special support pillows and similar devices can assist you adjust your sleeping position, keeping you off your back so soft tissue doesn't push on your windpipe and obstruct your breathing. Nasal sprays, adhesive strips, etc. These over-the-counter products improve breathing by making it easier for air to travel through your nose. While they can't help moderate or severe sleep apnea, they can sometimes help snoring and mild sleep apnea. Treating the underlying condition. Treating conditions such as heart failure can often improve central sleep apnea. Medication changes. Working with your doctor to decrease or stop opioid pain medications may be able to improve or even resolve central sleep apnea. Adaptive ventilation and positive airway pressure, PAP. Positive airway pressure is a technique that involves using a specific device to enhance the air pressure within your airway while inhaling. This approach is effective for treating obstructive, central, and mixed sleep apneas. By forcing pressured air down your windpipe, you may maintain it open and breathe. These machines force air through a tube that connects to a specific mask that you wear on your face while sleeping. Masks can be used to cover your nose, mouth, or both, and there are numerous varieties and styles to pick from. The continuous positive airway pressure, CPAP, machine is the most well-known PAP device. There are, however, several types of PAP machines. When you inhale, these devices boost the air pressure inside your airway and lungs, preventing surrounding tissue from forcing your airway shut. Oral appliances. When soft tissue in your head or neck, particularly around your mouth and jaw, presses downward on your windpipe, you have obstructive sleep apnea. Special mouthpieces can assist in keeping your jaw and tongue in a posture that relieves pressure on your windpipe. Dentists and sleep medicine professionals frequently collaborate to create these for those in need. Nerve stimulators. The hypoglossal nerve, the word originates from Greek and means, under the tongue, governs the movement of your tongue. When you breathe while sleeping, a nerve stimulator linked to this nerve can stimulate it, moving your tongue slightly forward. This prevents your tongue from relaxing and pressing backward on your windpipe while sleeping, which is one cause of obstructive sleep apnea. An electrode is attached to the nerve beneath your jaw and linked to a device implanted beneath your skin in your chest. You can activate the stimulator before going to bed and turn it off when you wake up. The electrical current is strong enough to keep your tongue from relaxing too much, but it's not painful. Central sleep apnea can potentially be treated with nerve stimulation. The phrenic nerves are affected by this form of stimulation. This pair of nerves connects your spinal cord to the diaphragm, a layer of muscle behind your lungs that governs your inhalation and exhalation. When you stimulate the phrenic nerve, those muscles contract and help you breathe. Surgery. Surgery on your nose, mouth, and throat can help avoid nasal, throat, and windpipe blockages. However, in adulthood, the impact of these is usually modest and varies from person to person. These procedures include somnoplasty. Radiofrequency, RF, is used in this operation to remove soft tissue around the top sections of your windpipe. Tonsillectomy/adenoidectomy. Removing your tonsils and adenoids can help to open up the space between your mouth, throat, and nasal passages. This allows more air to move through and reduces soft tissue that can obstruct your breathing. This technique is especially beneficial for children who suffer from obstructive sleep apnea. Uvulopalato-pharyngoplasty, UPPP. The uvula, the teardrop-shaped soft tissue that hangs at the back of your mouth, is removed during this treatment. Soft tissue is also removed from your soft palate and pharynx. These enlarge the space between your mouth and neck, making it simpler for air to move through. Surgery on the jaw. Different surgical treatments can gently alter the posture of your jaw, preventing soft tissue from easily pressing back on your airway. Nasal surgery. Septoplasty is a frequent type of nasal surgery that straightens the soft tissue in your nose, making it simpler for air to go through your nose and nasal passages. How can I lower my risk or avoid sleep apnea? Sleep apnea is potentially preventable, particularly when it is caused by excess weight or obesity. Even so, some persons who maintain a healthy body weight or are underweight suffer sleep apnea. Because a structural issue is usually the source of their apnea, they are unable to prevent it. The following are the best things you can do to lower your risk of sleep apnea: achieve and keep a healthy weight. Maintain proper sleep hygiene. Manage any pre-existing health problems, such as excessive cholesterol, high blood pressure, and type 2 diabetes. Visit your doctor at least once a year for a checkup. Now, check out this video to discover some helpful tips that will assist you in achieving a healthy lifestyle. Subscribe to the channel to receive regular health tips and advice. That's all for today, and always remember to stay healthy. Thanks for watching, and we'll see you in the next video.